Preanaesthetic medication. It is the use of drug before administration of anesthetics. Anesthetics के administration के पहले जो drugs देते हैं they are known as pre-anesthetic medication. It is to make the anesthesia more pleasant and safe. Objectives or aim of pre-medication: to reduce anxiety and apprehension. Anxiety और apprehension को reduce करता है. To prevent vagal bradycardia and to reduce salivary secretion caused by anesthetics. To prevent vagal bradycardia and to reduce the salivary secretion caused by anesthetics. To relieve pre and post-operative pain. To relieve pre and post-operative pain for anti-emetic effect. To prevent acid secretion and stress ulcer. To prevent acid secretion and stress ulcer. To hasten gastric emptying before emergency surgery. To prevent acid secretion को prevent करता है, stress ulcer को prevent करता है. And to hasten gastric emptying before emergency surgery. The first objective: to reduce anxiety and apprehension. Benzodiazepine like diazepam, lorazepam, and midazolam are preferred because of their sedative, amnesic, calming, anxiolytic effect and wide margin of safety. They reduce anxiety by acting on the limbic system, to prevent vagal bradycardia and to reduce the salivary secretion caused by anesthetics. Antimuscarinic agents like atropine or glycopyrrolate are used to prevent vagal bradycardia and hypotension. Antimuscarinic agents like atropine and glycopyrrolate, they will prevent vagal bradycardia and hypotension. They also prevent laryngospasm by reducing the respiratory secretion. ठीक है, वेगल ब्राडिकार्डिया को सप्रेस करेगा, हाइपोटेंशन को प्रिवेंट करेगा. वेगल ब्राडिकार्डिया को प्रिवेंट करेगा, हाइपोटेंशन को भी प्रिवेंट करेंगे और लारेंजियोस्पाज्म को भी प्रिवेंट करेंगे. These antimuscarinic agents also reduce the respiratory secretion. Vagal bradycardia, hypotension, respiratory secretion को prevent करता है, reduce करता है और laryngospasm को भी prevent करता है. Glycopyrrolate is preferred because it is potent, does not produce CNS effect and cause less tachycardia. Glycopyrrolate को prefer करते हैं over atropine because it is more potent और ये CNS effects नहीं produce करता है and it causes less tachycardia. More potent, less CNS effects, do not produce CNS effects and causes less tachycardia. Potent, less tachycardia and does not produce any CNS effect. To relieve pre and post-operative pain, opioid analgesics like morphine, Phetidine and fentanyl may be used to prevent pain. The limitation with opioids are respiratory depression, hypotension, nausea, vomiting, constipation, biliary spasm and bronchospasm and asthmatics. Okay, NSAIDs like diclofenac can also be used. Okay, पेन को रिलीव करने के लिए opioid analgesics या NSAIDs यूज़ करते हैं. और एंटी इमेटिक इफेक्ट, metoclopramide, domperidone or ondansetron may be used to control vomiting. Acute dystonias and extrapyramidal symptoms are the main side effect of metoclopramide. Metoclopramide का side effect क्या है? Acute dystonia and extrapyramidal symptoms. Domperidone rarely produces extrapyramidal symptoms. 5-HT3 antagonist like ondansetron is preferred. ondansetron को prefer करते हैं as a antiemetic because it rarely causes adverse effect and is well tolerated. ondansetron को prefer करते हैं as a antiemetic agent because इसका adverse effect बहुत कम होता है. Rarely it causes a adverse effect. To prevent acid secretion and stress ulcer, H2 blockers like ranitidine and proton pump inhibitors like omeprazole may be used to reduce gastric acid secretion and aspiration pneumonia. स्पेशली बिफोर प्रोनोन्स्ड सर्जरी। ठीक है, रानिटिडीन और ओमिप्राजोल को यूज़ करते हैं टू प्रिवेंट गैस्ट्रिक एसिड सीक्रेशन। ठीक है, स्पेशली बिफोर प्रोनोन्स्ड सर्जरी, रानिटिडीन इज़ अ H2 ब्लॉकर, omeprazole is a PPI, to hasten gastric emptying before emergency surgery. Metoclopramide or domperidone may be used. They are prokinetic agents. Okay, prokinetic agents are used to hasten the gastric emptying before emergency surgery. They are prokinetic drug. They will increase the tone of lower esophageal sphincter and accelerate gastric emptying, thus prevent aspiration pneumonia. So this is about pre-anesthetic medication.